Great. Good evening, everyone, and thank you for joining the Mount Kisco Interfaith Food Pantry for what I'm sure will be an informative and enlightening talk for all. I'm Roberta Horowitz, the Director of Operations and Programs. Before I introduce our speaker this evening, I wanted to let you know that the presentation tonight will be recorded. So if anyone needs to leave early or if you want to share with others, you'll be able to do so. If anyone has questions, please click the Q&A to type in your questions. The chat feature is going to be disabled for this webinar. Laura Damaris, who is the past president of the pantry and currently serves on the management committee, will be monitoring the questions, and we hope to get to most of them at the end of the talk. Dr. Katie Martin is the executive director of the Institute for Hunger Research and Solutions at Connecticut Food Share. She is recognized as a thought leader on food security issues and has over 25 years of experience developing and evaluating holistic solutions to hunger. Katie earned a PhD in nutrition science and policy from Tufts University and is the author of a new book titled Reinventing Food Banks and Pantries, New Tools to End Hunger, which we'll be discussing tonight. So I'll let Katie take it from here.
Thank you so much, Roberta and Laura, for having me, inviting me here, and for all of you who are joining us tonight. Thank you for taking time out of your busy lives to join in this, what I hope will be a really great discussion. And as Roberta mentioned, I am proud to discuss with you all tonight my recent book called Reinventing Food Banks and Pantries. And it was published in March, and it's been really heartwarming, fulfilling, and just inspiring to hear the impact that the book is having around the country and even around the world among food banks and pantries, community organizations, academic researchers, etc. And look forward to hearing your questions about this work and to hear about how my book is hopefully inspiring you to take action in your community. One of the questions that I get asked a lot is what motivated me to write my book. And really, it was based on my career of, like I said, almost 30 years now of conducting research on food insecurity. And by that, I mean having lots and lots of conversations with people who experience food insecurity and visiting many food pantries and food banks around the country, seeing really inspiring programs, and also understanding opportunities where we can do better. But my main motivation for writing this book and for doing the work that I do is to help single moms like this one in the picture here. This is my all-time favorite photo from the Fresh Place Food Pantry in Hartford, Connecticut. I just love the beautiful smiling face of the daughter who's shopping with her mom. We've got a volunteer who's co-shopping with them. There's beautiful produce. It's set up like a grocery store. I wrote this book to hopefully change the way that we think about hunger in America and the way that we approach it with our programs and services so that we can make it a more dignified process for single moms like this one, but also, and more importantly, so we can change the trajectory so this young daughter here doesn't have to experience food insecurity long-term. Some of the key themes that I write about and that I do within my work at the Institute are that we, and by we, I mean those of us who are tackling food insecurity in food pantries and food banks and in other community-based organizations, I think we're doing good work. We are helping a lot of people, but I argue that we can do better. And I encourage and I inspire you to dream bigger and aim higher in the work that you do in your communities. And some of the key themes that I describe are typically not black and white, cut and dried, yes or no. They're along a spectrum. They're along a continuum. And what I try to do is encourage you to think about where you are now in your work and then take one step along that continuum so that we can shift our work that's focused on often a charity approach. And really, no one likes to receive charity or to be seen as a charity case. How do we shift our work from charity towards justice? So much of our work is focused on pounds of food as our key metric. And I would encourage you to think of how do we add in layers to measure the nutritional quality of that food as well. Especially in the last 18 months, but really over the last few decades of providing charitable food, most of our attention has been, and the way that we describe our work is an emergency program, that we view our work as an emergency system to provide food for people today. But we know that this is a chronic problem. And if we really want to help people long-term and change the trajectory for that young girl shopping with her mom, we need to focus more on empowerment, helping people to help themselves. This is where we can shift from simple transactions of moving food as quickly as possible to more relational work, getting to know the people we serve, to ultimately get to more transformational work in our communities. So what holds us back from this bigger inspirational work? I think one of the challenges that we have in this work is the scarcity mentality. And I talk about this early in my book because I think it's helpful to think about how much this pervades our thinking and our programming. So when we think about individuals who are struggling with food insecurity, it makes a lot of sense that they are often focused on a scarcity mentality, focused on not having enough food to stretch throughout the month, not having enough money to pay and balance different bills, not enough time, not enough support. And they therefore adapt different coping strategies. They stretch their food, they borrow money, they focus on today, and often don't have the luxury for longer term planning. So a lot of our emphasis, I hope, is to help individuals to become more stable so that they can be planning more long term for their lives and for their families. I would encourage you, though, to think about how the scarcity mentality impacts us at the organizational level. When you think about how your organization is run, or an organization that you're affiliated with, how often do you hear things that ring and sound like the scarcity mentality? Well, we would like to try this new approach, but there isn't enough money, time, space, food, volunteers, equipment. We don't have enough. And because there's so many people in need, we just have to focus on providing food for today. This is what keeps us stuck in that emergency, short-term approach to tackling food insecurity. When we do this, when we carry this scarcity mentality with us, we also have coping strategies for our organizations, which lack our planning and lead to less evaluation of our work. So how do we bust through this? This is where we think about the larger paradigm shift. This is what I talk about a lot in the book, and the work that we do through my institute is to build the capacity in our food programs to more effectively address the root causes of why it is that people in our community are struggling with hunger and food insecurity. And we describe this paradigm shift in many ways, but for simplicity's sake, we talk about the 3 C's of the culture of your food program. What does it feel like when someone comes into your food pantry or meal program? Is it welcoming? Is it empowering? Is it dignified? Is this a place that you would want to go with your kids to shop for food? Or is it a humbling experience and an embarrassing place where you wouldn't want your neighbors to see you going into? A core component of this paradigm shift is around choice, allowing people to choose their food with dignity, allowing people to say no to certain food items. Choice during this pandemic has taken on a much broader scope for me and my thinking about how we offer choice, which can be online, can be over the phone, offering people the choice to continue getting food, let's say in a drive-through model, or coming back inside to shop in your food pantry. So there are many different ways to think about choice, but giving people the ability to choose is a core piece of this paradigm shift. And then the third C is around connection. Building connections and relationships with the people we serve to understand their hopes, their dreams for their future, and their challenges and their struggles and what's holding them back. Connection is also about collaborating with other great organizations in your community. This work is hard. This paradigm shift is big. We're not going to be able to do this alone. So it's exciting to see all of you here on the call tonight because you're part of this community. And this is how we can build more collaboration and connection with one another to do this work more systematically. And a lot of this work is based on one of my core beliefs, and one of the programmatic areas that we focus on is called More Than Food. And it's based on the premise that it takes more than food to end hunger. One of the things that I describe first in the book is thinking of how we define a problem helps to define our solutions for that problem. So when we define the problem of hunger as there's not enough food, which makes a lot of sense, people are struggling with not enough food, then our solution becomes very simple. We need to collect and distribute more food to more people. And usually we're focusing on efficiency. How do we collect and distribute more food to more people as quickly as possible? This lends itself to outputs. How many pounds do we distribute? Or we do a conversion to the number of meals that we distribute and the number of people that we serve. These metrics are very easy to gather. For a long time, our funders really loved seeing these metrics because year over year, we could show that these numbers consistently always went up. But if, on the other hand, we define the problem of hunger as a much more complex issue that's based on stagnant and non-living wages, underemployment, lack of access to healthy food in our communities, lack of affordable health care, health insurance, lack of affordable housing, utility, that is rooted in more systemic and structural inequalities based on discrimination and racism, then our solutions have to be more holistic, more coordinated to tackle this more complex problem. We know that if these items, these definitions of the problem on the left are true, then it lends itself to more policy approaches and more advocacy that are more upstream thinking. It's about building more collaborations with new partners of people who are tackling these other more complex issues in our community. That doesn't mean that we have to do all these alone or that we have to be experts in all of these, but we should partner with others. It lends itself to focus on more healthy, nutritious food and learning from the people that we serve, including those with lived experience in our programmatic designs, and evaluating what works through outcomes. This can help us get to more collective impact when we partner with one another through collaborations. I want to just provide a few examples for how we can do this more complex work. And in my book, I describe many different topics, and I provide examples of how folks around the country are doing this work. And at the end of every chapter, I provide action steps that you can take in your community today. And these action steps stem from tiny baby steps, things that are quite easy to do, to longer term, more aspirational work that may take a long time to achieve. But I want you all to think about what are some takeaways from tonight that you can hopefully implement in your work. I think language is really powerful, and it speaks to the way that we approach this work. So as we think about this paradigm shift, I would encourage you to think about the language that you use on your websites, in your newsletters, in your communication with your donors, in your grant proposals, in your social media posts, in the signage in your programmatic areas. There's so many ways to think about moving from a focus on need towards more strength-based language, having more welcoming signage that is a place that you would want to go visit, as opposed to perpetuating the stigma that is often associated with getting charitable food, where we want to keep our food pantries in the back of our program where it's really subtle so no one sees us, to blasting and beautiful signage so that it feels more like a community asset. I love hearing from folks that have rebranded their programs or their agencies to better reflect this more holistic, comprehensive view of the work we do. Centering our language around the people we serve. I am a fan of using language like customers, guests, neighbors to describe the people who use our services. There's nothing wrong with the term client. I think that's fine, but I think when we talk about the people who come visit us as customers or guests, it lends itself to thinking about our own experience as a customer or a guest. How do we like to be treated? How do you like to be treated when you go to your favorite restaurant, your favorite place to shop? It helps us think differently about the work we do. And then language, translating into the languages that are spoken by your guest is another key component. Different ways to improve the guest experience. One of the things that's so exciting, there's so many awful, crappy things that have taken place during COVID, so much death, suffering, etc. But I am an optimist at heart, and I love seeing some of the silver linings that have come about with COVID, as we've all had to shift to doing more of our work outside of our operations, doing drive-through distributions, not allowing people inside for public health precautions. This actually is the perfect time to think about how might you do a facelift for your food pantry. Is this a perfect time to clean out your shelves, rearrange your shelves to offer more choice, to put a fresh coat of paint on, to put new signage up, to redesign the way that you're operating your program? A key way to improve the culture is think about the amount of time that people need to wait for services. It's an opportunity to think of how frequently you are open, what days and hours of operation you have, the ability for people to come in and shop. I find that typically the programs that are open the least amount of days and the least amount of hours have the longest wait times, and often people standing outside in all the elements. So are there opportunities to shorten that wait time, have more comfortable areas for people to wait so that it's a more dignified experience? There's a lot of attention being paid to trauma-informed care. We know that if you're experiencing food insecurity, that can be traumatic. Many people who come to food pantries have experienced some type of trauma in their lives. The more that we as staff and volunteers that are serving those who are food insecure, the more informed we can be about trauma, the better we will be at providing a good guest experience. There are many types of trainings and resources that I would encourage you to think about for trauma-informed work. When I was writing my book, I knew that I was going to have a chapter on the role of volunteers, because there's no way that we could do this work that we do without a whole army of volunteers to support us. And yet, in my experiences of visiting food pantries, it strikes me and raises the question of who are we serving? And as important as volunteers are, I think unfortunately, we often design our programs and the hours of operation and the way we do things based on what is convenient and most meaningful for volunteers, without always paying closer attention to what is that impact on our guests and the customers who need us? Is this the most convenient and best approach for them? So when I was writing my chapter on volunteers, imagine my delight when I stumbled upon the Mount Kisco Interfaith Food Pantries website with this wonderful resource of information of applying to become a volunteer with this strength-based language, and then the volunteer handbook that lays out all of this great information for volunteers. This is really important, and I highlight this in my book, and I think it's great for other agencies to think through. How are they training and onboarding volunteers? Are they thinking intentionally about this work? So just really want to give a huge shout out to you all for thinking so proactively about the role of volunteers. I think some simple things that I encourage folks to do are designate a greeter, have a volunteer whose only role is to really greet people when they're coming to receive services. It's amazing how much just that simple looking someone in the eye and saying hello, how helpful that can be from a trauma-informed approach, and making people feel welcome and appreciated. Having periodic trainings about the mission and shifting power from volunteers to the people served are different ways to think about the role of volunteers. Another key focus of our work that I highlight in the book and that we're doing at Connecticut Food Share is around promoting health equity, making it easier for people to choose healthy, nutritious food. So as we allow guests to choose their food with dignity, it provides opportunities to create nudges for healthy behavior, making the healthy choice the easy choice. Designing food pantries to look more like a farmer's market or a Whole Foods. We have a stoplight system called SWAP, supporting wellness at pantries, that is a great tool to be able to rank food nutritionally based on saturated fat, sodium, and added sugars. And it can be a great way for food banks to rank the inventory of the food that they have coming in, for food pantries to design their shelves based on green, yellow, and red to provide information for guests, especially those who are struggling with a chronic disease risk. And it's been exciting to see this being adopted nationwide, and Feeding America is using the same guidelines from healthy eating research that are now kind of the best practice, and SWAP is aligned with those resources and those guidelines. So then we think about addressing root causes of hunger. This is where we can think about additional wraparound services. Perhaps having a bulletin board of additional resources, having a center, like a space within your food pantry to offer information and warm referrals for other existing community referrals. Invite other agencies from your community to come on site to your pantry to help provide outreach about the services that they provide, to help enroll people in their services, offering space for classes, workshops, etc. So if you don't have a lot of space, maybe that's having a core volunteer or two who are knowledgeable about other existing programs and referring folks to go to those other services. If you have even some space, to be able to offer additional information for existing community resources. When you learn about the additional needs that people have in your community, that's when you can start looking upstream to say, okay, we know a common challenge for many people in our community is high cost of housing, limited utility assistance, lack of childcare, need for English as a second language, for computer skills, workforce training, etc., then you can start advocating for larger systems change, and again, partnering with others that do this work. If you're ready to go one step deeper in this work, I talk about training for coaches to provide motivational interviewing. This is a great skill set that's rooted in social work, and it strengthens a person's own motivation and commitment to a specific goal. So as you move from just providing a passive referral to a warm referral that has a follow-up with guests to see, did they take advantage of that referral? Was that workshop helpful for them? You can engage in longer term coaching sessions that are more collaborative, strength-based, and working with individuals to find out what goals they have for their life and helping them to meet longer term goals. We have coaching and resources for this type of work if you're interested. So my question for you all tonight, and in the book and in tonight's presentation, as you can see, I kind of throw the kitchen sink in there. There's a lot of ideas. I hope that you find some inspiration and some ideas of how you will reinvent the work that you do. And I would encourage you to not get intimidated, just get started. The best way to get started is to think about, what are you doing really well? Because again, you're doing really good work in your community. And talk with your volunteers, your colleagues, your staff, and think of what you're most proud of, right? Start there. And then what are some key areas that you want to make improvements? What's one step that you'd like to take? Because if not now, when? And if not you, then whom? If you're not familiar with our Institute, I would encourage you to check out our resources. Go on our website at foodshare.org/institute. We provide monthly newsletters with updates on resources and information. We also provide monthly webinars where we talk about different topics. And during those webinars, I often invite other colleagues, partners to share their best practices and share the work that they're doing. So I would love to hear from you about the steps that you're taking and the way that you're transforming the work that you do so that we could highlight you in our newsletters and in our webinars. Thank you so much for the opportunity to be here. I would encourage you start adding questions into the Q&A box. We're trying to get more active on social media. So I've got my Twitter handles and Facebook for me personally and for our Institute at Hunger Institute. I would love it if you can tag me or the Institute when you're to highlight the great work that you're doing. Share the work that you're doing, tag me so I can highlight it through our Institute. And here's more information about the Mount Kisco Interfaith Food Pantry. And Laura, I will hand it back to you.
Excellent, Katie. Thank you so much. This is really exciting stuff. And you know, one of the things that I remember from your book is the phrase. I think that anybody who reads your book would have this imprinted on their mind, is the take one step toward a big, hairy, or audacious goal, which I just adore. And I feel like there's so much great information in your book, so many inspiring ideas that you've shared with us tonight, that it both inspires, but you're right, it can be a little overwhelming to think about, gee, I want to do it all and I want to do it yesterday. So maybe we can think of it, you know, taking one step toward a big, hairy, audacious goal of getting at the root causes of hunger and serving our guests better, is working together, and this collective impact you talk about. So it's very exciting, I think, in particular, that we have so many people represented tonight listening in who come from our sister organizations, who are working together with us across Northern Westchester and beyond to make a difference. So I think it's really exciting to have you here and really exciting to have them here as we continue our joint conversation toward moving ahead. So as you've already mentioned, the Q&A section is open. We do have a few questions there, and I have some questions of my own I would love to ask as well, but I will hold mine to the end so that I can make sure that the folks who are listening in have a chance to be heard. And so the first question we have is from Cecilia Rosenblum, who asks, how can we best measure a successful home delivery food program serving our homebound neighbors, especially during these difficult times? Have you had experience, Katie, with seeing these sort of metrics utilized in that particular type of mission or program?
So I kudos to you, Cecilia, and others who are doing home delivery food programs. It's just remarkable of how much on the front lines and essential workers you really are. So kudos. Some suggestions for that of how you might measure things. I mean, it kind of depends on what you want to measure. Do you want to measure satisfaction with the program, which can be a nice place to start, is especially if you're serving the same folks on a routine basis that you know they're homebound, so they're getting food from you once a week, once a month. You could, include a brief questionnaire for folks to ask about the food items that they're receiving. Are there ones that they like most? What would they like to see in their home delivery? What are some items? Thank you, but no thank you. Can you introduce some level of choice by asking folks about their satisfaction with that? And then maybe other ways to connect folks with other resources, even as you're delivering homebound meals to them. So whether connection to services. That's an opportunity to gather some feedback from the people that you're serving. That's one opportunity.
Excellent, great. So another question, this time focusing on volunteers. The question comes in: as the mother of middle school children, I'm often asked about volunteer opportunities for children. I'm wondering if you've seen any unique programs that respect the dignity of the pantry guests while engaging our younger community members.
Mm-hmm. Yeah, this is a great question too. And, I think for many programs, certainly food banks, there's often, some age requirements, like you need to be over a certain age to be able to do some volunteer work. But the younger we can engage folks in this work, the better. So I guess I'd say one of the things you want to avoid is perpetuating the us versus them, or for folks to feel like there are those other people out there that are hungry, and we need to, provide food for the hungry and the other people. The more that you can have ways to maybe conduct some research and just through local information or your United Way local information about, have kids explore who might be food insecure. What might that look like? What are some reasons that people in your community might have a hard time getting enough food? Have them explore some of those underlying root causes that they might not have thought of, so that you can engage them to think of, there's food insecurity in every community around the United States. So not having folks think that it's someplace else. The other thing is when we do food drives, I love the more that we can ask guests and customers what their preferences are, and then shape those food drives based on the client needs. So middle schoolers could be engaged with a food drive that they know is tailored specifically to what that food pantry is looking for and what the guests are looking for. So how can we get kids involved with thinking what that might look like, so it's a more dignified approach?
Thank you for that. You mentioned this idea of food drives and being sensitive to the preferences of our clientele. What do you do, Katie, when there is a disconnect between the dignity that is implied in choice and the dignity that is implied in supporting nutrition? So there might be some cultural choices that we now know might not be the, the green on your swap light, might be a yellow or even a red. Is it by using nudging? Or are there other techniques that we can use to encourage folks to, maybe be interested to explore things that might not be their first choice?
Mm-hmm. So there's a few different examples. And I think by understanding the preferences of the people who are coming to your programs, your pantries, you're going to get a lot of it. Like, that's nutrition education for us. Like, they're educating us on the types of food items that they want. And I think we have this misperception that people who are food insecure either don't know what nutritious food is or don't want nutritious food. And there's so much research to the contrary, that there is so much demand for healthy, nutritious food. And unfortunately, so often nutrition education is coming from a white middle class perspective. And many registered dietitians are all white women. And so that does not mean that there are other cultural preferences that aren't equally nutritious, that just are coming from a different preference. So as you gain insights, there are so many, especially new immigrants who come to our country, have much healthier diets than we Americans do. What can we learn from them? And then how do we incorporate those preferences? That can entail, like, we have to engage with food donors in a different way to make sure that we're getting the most nutritious food that we can from our food donors. So soliciting different types of food. If you can ask folks about their preferences and then have them share their recipes with you, that can be a great way then to, when someone comes to a pantry and you've got a meal kit that's designed based on their family recipe, how empowering that can be, and to celebrate the cultures of the people in the community.
What I'm hearing and what you're saying is, a through line in many of the other things that you say, which is the conversation is so mutually rewarding. And so that's the way to think about it. And that's I think, a lovely and informative, new lens, or maybe not a new lens, but a reminder lens. I wanted to offer something that was put into the chat by Christine Johnstone Bruce, who had an idea for our mother of middle schoolers, who she says an idea to get kids involved could be to do research or Eagle Scout, etc. projects by learning the newer methods of growing food in limited space environments, like vertically growing versus horizontally. So a clever idea about engaging people and children or younger folks in new ways to explore and engage.
I love that. I think any way that we can just tap into the creativity and ingenuity of young kids, like, just think totally, they'll think out of the box in different ways than we can. That's great.
We have another question. Do you have examples of output-based measurements for providing nutritious food?
Mm-hmm. So the cool thing with SWAP is it lends itself to a lot of data. So at the food bank level, what we're doing, so like Feeding Westchester is likely your regional food bank. We are starting to, or we have been ranking our food with SWAP. Then we can run metrics to look at what percentage of our food is green, yellow, and red. We can then use that to look at which food donors are doing great work and celebrate them, which food donors could use some improvement. We've also measured, by using SWAP, we've measured outcomes of what types of food customers are selecting when they go to a SWAP program. So we've done a lot of research at different levels at the client level, the food pantry level, the food bank level. And I partner really closely with a good colleague, Marlene Schwartz, who works at the University of Connecticut in the Red Center for Food Policy and Obesity. She and I have done a fair amount of research looking at those types of outcomes when you implement SWAP. what kind of impact does it have on the choices of people who shop at the pantry? And what we've seen is when SWAP is implemented, clients choose more green food and less red food. When the food bank has those rankings online, the food pantries order more green and yellow food and less red food. So there's a lot of different ways to think about outcomes.
Great. Do you have best practices for effective partnering with other organizations in the community who provide services that may be of interest to guests?
So I think it's great if you can identify what are the common challenges or needs that people have, then engage with community partners that may be able to offer those resources. Relationships like that often take time, right? To build the trust, to know who has services that are available that is willing to partner with you to have a seamless one-stop shop experience. So collaborating with folks who will come on site with you is really amazing. What you want to avoid is kind of that passive referral where it seems like a collaboration, but you're providing a number or a website and then it's not a fruitful referral. So if you're not as familiar with that organization and then the client is banging their head against the wall because no one answers the phone and they're not available, that's not as beneficial. So the more that you can get to know those community partners and make sure that that referral is going to be effective in helping people long-term. There's a lot of innovative work that's happening. Community colleges are doing so much outreach with job training programs, SNAP outreach, other things. They can be logical, great partners for agencies in your community. Healthcare partnerships, as people are seeing their clinician and they're being screened for hypertension or diabetes, connecting the dots so that people can either go on site for a food pantry at a community college or a clinic, or that there's a really strong partnership so that those students or those patients can seamlessly get into a food program to help relieve the need for food. So those are a couple examples.
Excellent. Have you found it to be an asset to have volunteers who speak languages other than English?
Yeah, absolutely. And I think I love the idea of recruiting volunteers or offering opportunities for volunteers to be customers who shop at your pantry. I think it can help break down the barriers between us and them, giver and receiver. Even better if they're right from the community and they can say, oh yeah, like I come to shop for food too. And this is, it's a way to reduce that charity mentality and giving back. I was just on a call the other day with a really innovative program in Texas that serves a lot of newly released prisoners. So people who've been previously incarcerated, and they they train them in different resources. They provide opportunities and they engage them and they hire them on as staff in the food pantry as kind of that transition step. So not only are they volunteering, but they're getting paid for their time too. So the more that you can engage with people, either from a language perspective or just their lived experience, is great.
So we have some other really interesting ideas suggested by Christine Johnstone Bruce. Another no-cost service could be to offer coaching on interviewing skills, learning how to build LinkedIn profiles, how to build a resume or answer an application for employment. So this idea of getting at the root of the problem, there may be some interesting, innovative, low-cost or no-cost ways to provide services that the community really could benefit from and would be grateful to engage with.
Yeah, Christine, I love all of those. And some thoughts on that are asking folks in your program, like, would this be something that they'd be interested in? If you think about the language you use to describe that kind of service, how can you frame it so that it seems like a no-brainer? Like, of course, you'd want to take advantage of this program because this is going to help you, get a better job, find a different job in this crazy economy with COVID, et cetera. And don't expect that everyone's going to want to take advantage of it. So it's okay if you offer that kind of program or service as a workshop and 2 people show up. Don't get frustrated about it. You're going to help 2 people advance their skill set and get better prepared, and then hopefully have them become ambassadors and cheerleaders to recruit other folks to say, hey, they helped me update my resume. You should go, they offer this on Saturday mornings or Tuesday afternoons. And, this is something that's going to be helpful. Starting small, and don't expect that everyone's going to want that, but probably many people will over time.
You mentioned, Katie, language in that answer, and it reminds me of your discussion about strength language. And I would be really curious to hear some examples of strength language as opposed to sort of weakness or need-based language, just as a, going forward, so that we can be mindful of the, the things that set the right tone.
Yeah. And I just am a fan too of just making it more conversational. If you're creating a program or you have a flyer or that you're describing your services, the more think of it in the way that you would describe it to a friend, as opposed to, I think too often we get caught up in making it sound too fancy and it's maybe intimidating or confusing. And then people don't necessarily want to take advantage of it. So, and we shouldn't make the assumption that, like everybody wants to focus on their needs and their problems and their challenges. Like we want to support, like, what are your goals? What are your hopes? Making it more strength-based and the things that are going to encourage people to want to get involved in.
It's actually a way we could also think about this as we can consider ways to move our pantry forward, is maybe not to, what are our goals and strengths, as opposed to, what are we getting wrong?
Exactly. Yeah.
So we apply that at the organizational level too. Christian Ayala has a question for us, going back to how to reduce waiting time when guests come to the pantry. Do you have any suggestions on how to arrange our products to help a quicker and easier visit?
So a couple suggestions. If you can do appointment-based times, again, it kind of depends on how many hours a week, days a week people are able to come and shop. So that can be helpful so that you automatically know you're only going to have so many people coming in a time slot. The flow of a food pantry, the way it's designed, can help reduce that wait time. So I often, when I do site visits with food pantries, it's a matter of like think of your experience the next few times that you are shopping in the grocery store. Think of how that feels and think of where the bottlenecks are and where does it get slowed down. How can you design so there's, easy flow in and around the aisles and the shelves, even in a small space? So what you don't want to have is there's just one way in and one way out. So if somebody's going in and shopping, there's no real way to maneuver to move around. So that's one example. I think the more times you allow folks to be able to come in and shop is probably the easiest way to reduce the time. And get creative, talk with folks, try different things. So if you've got it laid out one way, you've got one table set up here and people pick up food at one spot, can you move that around to a different, sometimes just thinking out of the box and trying a few different approaches, it may open up different opportunities that you didn't think of, like, oh, wow, if we lay it out this way, it's going to reduce the bottleneck of people waiting over here.
Katie, you mentioned in your presentation this idea of having bright signage, bold signage, welcoming signage. And I think that can be a paradigm shift too, because there is, a perspective that might be, let's encourage more privacy. Let's have a door that maybe somebody wouldn't see someone entering. So I think that's a really, interesting way of thinking about things. Maybe you could tell us a little bit more about your experience, how clients or guests respond to that sort of thing. Just very interested to sort of explore further that paradigm shift.
Yeah, I mean, I think, and for those of you who are getting inspired to do this, like take before and after photos, please share them. Um, and then respond, like keep track of the response of folks that come. So we, we just provided some grant funding to a food pantry in Connecticut that did a total facelift, and it was some simple things, but repainting their area, they redid the floor, they, repositioned the shelves. And I said, what was the reaction of people who came in? And they said, well, the guests love it. They just, like it's amazing, but the volunteers do too. So you think about people who are coming, they're spending their time to come and share their time and talent with us as volunteers. It doesn't have to be this dingy place that people, it's kind of the crappy, we're sitting here bagging up food in the back corner of the basement of the church. Let's get out of the basements. Let's make it a more welcoming place that we'd all want to go visit. And I think we can perpetuate, unfortunately, the stigma and the shame and the humiliation of getting food. It's one of the things that I've been concerned about with COVID is hearing about people who are newly food insecure, but have never used a food pantry before. They don't know how to use our services, and they don't want to take advantage of them because they think they're going to take food from somebody else who needs it more. They feel like there must be other people who need it in the community. Our messaging, our communication can help make it clear that everyone is welcome. We have plenty of food. Come and get it when you need it.
I'm really interested in motivational interviewing, and you mentioned that it is founded in social work, but as I understand it, it is not done by social workers. It is done by people trained who might be volunteers. Can you tell us a little bit more? Because I think one of the concerns an agency might have is, what if this volunteer is presented with information that is upsetting or triggering or doesn't know how to respond? So I assume that the training addresses that. I'm sure that's been well thought out. So maybe you could speak a little bit more about motivational interviewing and how successful it is, for that, for that set of agents doing it.
Yeah, no, it's a really good red flag to consider. You don't want to go into, like in-depth coaching lightly. You want to think about that. So motivational interviewing is a great way of thinking. It's non-judgmental. It is strength-based. It is intended to draw out of an individual what are the goals that they have for themselves. I'm not telling you what you need to change in your life, but rather you're telling me what are the things that you want to work on. I think it's a great skill for volunteers, even if you're not doing full-on coaching, just to take that step back and do more open-ended questions. It helps build relationships. So I think there are some really good nuggets in there that can be beneficial for a lot of people. As you get into more long-term coaching, then you're right. I think there are more, we talk about professional boundaries, we talk about ethics, we talk about confidentiality, and more of those kind of approaches that do require more thinking. So I think you're exactly right. But I think there's a lot of benefit in just the overall approach of thinking about motivational interviewing.
And I think one of the things that that it suggests is that a conversation, and I haven't gone through the training of motivational interviewing, so I don't know exactly, what it suggests, but that a conversation at that level would not necessarily be seen as invasive or a waste of time. TikTok, I've got my third job I need to go to, I need to be getting on, that there may be ways to engage in these conversations in a way that is mutually rewarding and desirable and even, supportive of dignity, without being invasive or feeling like, I'm being questioned or anything like that.
Right. Well, and let me be really clear that the coaching that we advocate for is not for everybody in a food pantry setting. So it's really more of, you can offer it as an added service for those who are interested and ready to take that approach.
Debbie Bernardini has a question for us. How do you reconcile the need for healthy choices with the reality of shelf-stable and canned options?
Yep, it's a great question. So the cool thing with Swap is it's for every food item. So obviously fresh produce is always a green and we want to promote that, and that's great. But we know we're going to get a lot of canned products. By ranking the food nutritionally, you're going to get a better handle on a lot of your food donations and to understand which types of canned items and shelf-stable items. I think you'll be surprised at how many are green and yellow already. And then where do you have room for growth? And then that opens up the opportunity to have conversations with your food donors, for those who are doing food drives in your community, to say, this is the type of food that we're looking for that has lower amounts of saturated fat, sodium, and added sugars.
Katie, what is it that brought you to this field in the first place? I know what brought you to writing the book, but you've had a long career in this space.
Yeah.
What excited you about this type of career?
Yeah, I always knew that I wanted to make a difference. I wanted to help people. I was very passionate about environmental issues, and I thought that I wanted to maybe join the Peace Corps and go overseas. And I had a really life-changing internship with my congressman from Dayton, Ohio, named Tony Hall. And he has spent his career advocating for anti-hunger work. And he really sparked my interest specifically in the preventable problem of hunger in the United States of America. And that shaped the rest of my career.
We have one last question from Christine Johnstone Bruce. It's actually more of a suggestion. She talks about Lean Six Sigma. Are you familiar with Lean Six Sigma?
A little bit.
So she says it's another type of thinking that can provide others to brainstorm. Often people who face challenges are very good at adapting. LSS is often intuitive to people who have to figure out how to solve problems. It's another simple solution which can motivate everyone. So Christine, thank you so much for sharing your ideas. You're a font of exciting ideas. It is time to close. I could talk to you for hours. Katie, it's so thrilling to have you here with us. With that Q&A at an end, I will hand it back over to Roberta to say goodbye.
Thanks, everybody.
Okay, what an exciting evening. I just want to thank everybody for joining us tonight. And remember that this was being recorded. So if you missed anything, you will be able to learn all that is needed. And thank you again, Katie, for for joining us this evening.
It's been my pleasure, and thanks for all the wonderful work that you are doing and those of you on the call. Thanks.
Take care. Good night, everybody.